I am a CCHP. I was one of the first group to take the test when the test was sent to us at home.
I'm a CCHP for years. I'm proud of it.
CCHP to me is kind of like a badge of honor.
Quality, commitment,
Community.
Professionalism.
I became initially involved with the CCHP because I believed in the standards, and I still today, 30 years later, believe that it is the best management tool that you can have in your system.
The Board of Trustees has been very active in making sure that we have specialty exams, the mental health exam, the RN exam, the physician exam. Those have evolved over time, and they're looking at best practices within those specialty groups. And we're very proud of how that has taken hold over the years.
This is a credential that gives you credibility in your environment.
Certification says you understand your field.
I also think it's internally validating to get your CCHP, to say to yourself, I have mastered a set of skills, I have mastered a set of knowledge, and I have demonstrated proficiency in doing that.
Certification, I think, is the mark of someone who wants to know more and do better, not because they have to, but because they want to.
Well, what it did for me was to help me encourage all of the nurses that I was working with to do the same thing.
Ned McGargy.
He was the one that made the CCHP successful because he knew how to do, it was a written test, and he knew how to develop written tests with validity standards and stuff like that, and made it successful.
Oh, the standards have evolved through time, and one of the challenges in the CCHP examinations is every time there's a modification in the standards, we have to go through our question book and see, do the questions currently reflect what is in the standards?
He's probably taught me as much as grad school did.
I think it's had a wonderful impact. I find myself respected more among my colleagues. I find myself listened to more when I advocate for evidence-based best practices.
But the certification process is a meaningful step in one's career advancement, and I think it's very important not only for the healthcare professionals that work for us, but also for the administrators to gather really a body of knowledge.
It gives you that base and that foundation to understand where we're heading in correctional health care, and that's to provide good basic constitutional health care and keep current with best practices.
If you do the highest quality of care based on accreditation standards, and you yourself personally can be certified, then you know you're doing the best job that you can.